With that, we'll go ahead and open it up to some questions here. Okay, so an anonymous attendee asked a question: thoughts about correlations between the phenomenological experience of conversion therapy to therapies target at masking autism and other neurodiversity. Oh man, okay. I am going to chew on that for a minute here. That's it, you know, I don't have enough direct knowledge about the experience of autism and particular attempts to create behavioral compensations for autism. And so I'm hesitant to speak about that given my paucity of knowledge there. But I will say, dialing it back a little bit to talk about conversion therapy, that there's some fantastic work that's going on right now to create survivor networks with conversion therapy survivors. You can check out ctsurvivors.org. And there's also some really encouraging work to begin looking at a data-driven point of view, some of the common clusters of symptoms that are experienced by conversion therapy survivors. And so I recognize this isn't a full answer to this attendee's question, but I will say that this is work that is actively being studied right now at the behavioral point of view. And so I do anticipate, I would forecast there will be convergences between the symptom clusters that you see for these types of behavioral masking attempts. Like I said, I'm just hesitant right now to speak too quasi-authoritatively about them since I don't have direct knowledge about that particular set of symptoms. Okay, this is from Martin Kokel. If we can find the places in the brain that are stimulated by spiritual experiences, then could science soon partner or supersede organized religion for the sought after rush of belief, of confidence, of peace sublime? Okay, so this is a big question. My short answer is yes and no. We're already seeing this sociological trend where an increasing number of individuals are identifying as, quote, spiritual but not religious. That to me indicates that there is something that is happening in this domain of personal spirituality that is scratching an itch that has been scratched traditionally by religious institutions and organizations. I am going to say that given some of the preliminary work as well that is coming out of my examination of tradition-oriented religiousness, these are brain circuits that are non-identical with one another. In other words, from the preliminary data that I'm observing, the brain circuits underlying mysticism and the brain circuits underlying tradition-oriented orthodoxy are not identical brain circuits. And so extrapolating quite a bit from that, given that those are distinct and differentiable brain circuits, I don't anticipate that mysticism alone will fully replace or subsume all of the different functions and needs that are being served by tradition-oriented religiousness. Given the work that you have done, both your own personal work and the reviews that you've done, looking at the brain's responses to beauty, what are your current thoughts about there being some kind of an objective or transcendent aspect to beauty, as opposed to beauty and our responses to beauty really being something that is primarily subjective or constructed?
I think that's hard when you try to get to an objective measure. It starts pushing me towards the whole idea of what Dr. Galton was thinking of. Is there some objective finding we can say that is beauty or not? So I think that's a little bit difficult. The three measures I spoke about can be measured in people. They actually take the pictures, they look at measurements of where the eyes are, each part of the faces, and that's how they can say this is averaged more than another one, and this is more symmetric than another one. But I think that the cultural component is too strong, especially when you try to go beyond just the face.
Okay. And then a little bit in tandem with that, you had talked about how symmetry is one of these principles that seems to be predictive even across cultures for the perception of beauty. So when you're looking at these averaged face experiments, has there been some work to control for differences in symmetry? If you're averaging faces, you're going to be averaging out some of the asymmetries in the underlying faces. Is there some indication that even if you control for the symmetric differences that are introduced by averaging, that there really still is some kind of a prototype-like effect at play?
There is. People have looked at trying to pull out the different components, and you can separately. There was one study in particular that found that averagedness did show significant differences in attractiveness, but symmetry, when you isolated it, did not. When they actually took those averaged faces and looked at symmetrical differences, that actually did not fall out as an indicator of attractiveness. So there's a little bit, but you're right that when you average faces, the assumption is that you're going to pull together all those averages to kind of normalize them to symmetry. But there's been a little bit of work that tries to pull the two of them apart. Most of that work says that symmetry falls out as not being important in attractiveness, whereas averageness is.
Okay. And then Dr. Bartona, I want to ask you another question. This is from Jacob, who asks whether there are any differences in perceived attractiveness between different versions of the same face. So example, smiling versus frowning versus scowling or sad, or intentionally making a quote unquote an ugly facial expression.
So there is some work looking at that. Generally speaking, happiness faces do tend to have higher ratings of attractiveness, particularly when compared with fear or disgust, as kind of the far apart dichotomy of emotion. You know, you have surprise, you have a few other things mixed in there, including the neutral face. But happiness does tend to get higher ratings than disgust or fear. But you can look at the same face and so that's if you're looking at one face and you're pulling all of that apart. However, if you're comparing different people with different emotions, the attractiveness of that group of individuals is still higher than otherwise. So look of fear on an attractive individual is still going to be higher than the look of happiness on the unattractive individual. Does that make sense? So it's a bit of both, but it depends on how far apart that spectrum is. Quickly looking at his other question. So the behavior I might have kind of answered, but in terms of non-visual, there's a couple studies out there looking at smell and pheromones. People wore the same shirt for days, and then they had other people smell that shirt. And they did see some differences, particularly when women were smelling men's shirts during particular phases of their menstrual cycle. So there is a little bit of attractiveness to smells if you want to go beyond visual stimuli.
Interesting. Okay. I want to say in advance that the answer to my next question is probably no, but I'm just going to ask it anyway. So has there been any work to look at the underlying geometrical composition of some of these chemical structures that are perceived as desirable? Like, you know, and let me back out, let me like zoom out and think about music. Maybe music is a more readily ascertainable abstraction. That my understanding is that musical structures that have some kind of embedded temporal geometry are experienced as beautiful. That if you have a structured sonnet, that there is an underlying geometry to the temporal dimensions that correlates to the experience of that sonnet as being beautiful. And so like, how far could we push this? That like, you know, even in an olfactory dimension, that some kind of geometrical content to the olfactory stimulus could be translated into the experience of beauty. I know I'm pushing it, but let's see where you draw the boundary line.
So I'm going to take that as two separate questions, one with smell and one with music. I have no idea what the data is looking at the actual pheromone composition. I'm assuming it's been done, but I don't know. Music is very complex, and you know I love our understanding of music and consonance and dissonance in particular, and I think it's complicated. And last I really looked into that literature was like 12 years ago, so I don't know currently what people are doing. There's so many different aspects. In terms of one thing you said was more temporal. So if you take rhythm, there are certain rhythms that get people interested. You take a regular rhythm, people want to dance if they just hear a beat sometimes. It makes you move. Like there's a very obvious association with that. Consonance and dissonance is a whole nother level. And you can mathematically pull it apart, but that's very complex. And I don't think I could go into that right now. But absolutely, that's probably one of the more fascinating things in my mind for aesthetics.
Thank you very much. There's a question about neurospirituality, and the question is whether there may be a danger of denaturing spiritual practices by using them as therapy. And I think that this is a very pressing question. I think that there is definitely a danger of denaturing. I think that there's a danger of overconfidence in believing that we have now, identified like what is the kernel for the mechanism of action, when in fact we're only looking at a very thinly reduced aspect of what's going on in the more holistically rich spiritual practice. And an example of this would be meditation practices that have been culturally reduced in the forms of mindfulness-based stress reduction. So mindfulness-based stress reduction, or MBSR, is one of the most widely studied forms of behavioral practices that could be classified as spiritual or spiritual adjacent. With mindfulness-based stress reduction, you're training the individual essentially to focus their attention on their breath. And there are great indications that this is clinically related to decreases in anxiety and to a number of other features in the person's emotional and mental states that are desirable from a therapeutic or clinical point of view. However, clearly, if you're talking about just focusing on your breath and reducing anxiety, you're not talking about escaping samsara and the wheel of suffering for some kind of superior karmic state. There are things that I think are very essential from the cultural context of spiritual practices that, yes, are definitely lost if you're abstracting these practices and putting them into some kind of a sterile or a culturally flattened domain. I'm very interested in this regard then in looking at culturally enriched spiritual practices as well as culturally reduced spiritual practices. So for example, if you have a patient, and we'll just stick with this example of meditation, mindfulness, and Buddhism. If you have a patient who comes in and who has a Buddhist cultural background, I'm very curious the ways in which now having a hospital chaplain interact with that person's meditation practices in a way that integrates their enriched set of narratives about the greater meaning of that mindfulness practice may or may not have an effect above and beyond a culturally reduced practice of mindfulness, where you have no elaborate narrative about the cosmic meanings of this behavior. You're only focusing strictly on the breath, the attention, and these physiologically direct measures. So this question of culturally enriched versus culturally reduced spiritual practices is one that I think has to be studied as we move forward, both for the intellectual curiosities of the effects that cultural belief have on an individual's physiology, but also for the therapeutic questions of quote unquote like personalized medicine or personalized spiritual therapeutics moving forward. Since I'm not a clinician, I'd be very curious to hear from for those who are clinicians in the room, what your thoughts would be about this notion of culturally rich versus reduced, of generalized versus personalized spiritual therapeutics. I'm not putting you on the spot. You can hold that thought, think about it. And if you have any thoughts or insights that come to mind, by all means, please feel free to give them voice.
It's an interesting question, but I personally don't do a lot of that with my patients. I suggest it and I recommend it. And then it's usually, these are things I want you to do, or this is a therapist, or this is somebody that does meditation that I would like you to talk to. So I don't always see that clinically as much as I would like to. And so when I get the follow-up, I find out, did they like it, did it work, did it not? But I don't really get to see that experience.
And we have a question that's related also to this notion of spiritual therapeutics. And the participant asks, can an individual be trained to experience spiritual states? And they reference again the returned missionaries from the LDS study who practiced spirituality for many hours over many months. This is a great question. At the behavioral level, yes, we certainly do see that there is a training effect that creates and facilitates the individual's ability to experience the prescribed or desired state. And so again, let's dial it to one of the more straightforward and well-studied examples, which is mindfulness-based stress reduction. That there is a wealth of evidence that indicates that the more that individuals practice these types of behaviors, the more rapidly and efficiently they're able to enter into these states of mental calmness and clarity, of emotional stability, that are the desired states associated with these particular behaviors. We also have, from the neuroscientific point of view, a growing understanding of neuroplasticity, or in other words, the fact that the brain does rewire its own circuitry in response to behaviors and to the feedback of experience. And so both from the existing behavioral literature, in addition to the principles that we can extrapolate from neuroplasticity, there is reason to suppose that individuals can indeed be trained to experience some of these spiritual states that may not necessarily be the most organically natural for their particular experiential and biological profile. At this point, I want to invite Dr. Vold and Dr. Glutenic back into the conversation as well. And I'm going to circle back to some of the questions that we have not yet addressed from the whole symposium proceedings. And we'll start with this follow-up from Maggie McCann to Dr. Vold. And this is with regard to the self-determination question or self-identity as it relates to extended mind and to theories of extended mind. And Maggie says, I think ultimately my question is part of a larger one on how Chalmers and Clark understood the mind and what the relation of this particular kind of whole to its parts is. So in my mind, a biological whole is one in a more intense way than an inanimate object is one. Maybe a better way of putting it is, how is the oneness of a person maintained with the outsourcing a part of the mind to a notebook? And how does this change self-identity? It is probably too big of a question to have over a chat, so we can skip it. We're not skipping it, Maggie. Thank you for the answer to the first part of the question.
All right, well, I'll try. It is a big question. You're right, Maggie. So, I guess part of the answer is that, I'll speak sort of saying what I think Clark and Chalmers' position is, since I think that's a bit about how you asked it, which is that they're open to the idea that the mind is an essential part of the self, but they don't take a position on whether or not the self extends. But other people have written about this, people who work more in personhood, and I'm trying to think of the author's name, and I apologize for not remembering, but I know she argues that the subpersonal mechanisms can extend sort of beyond the biological self, whereas person level mechanisms do not extend beyond the self. So there's sort of different views on this, I guess. And some people are more willing to accept that the self extends and others don't. Obviously, if you maintain that an extension of the mind sort of implies an extension of the self in some sense, then you end up facing this issue of, well, you described it as oneness, but I guess there's a question of how does that self maintain some kind of integrity? So you might have parts of yourself in different places. That all seems very messy, right? And that's what a view like that would look like. So it would start to get kind of messy, just like you could have parts of your mind kind of all over the place on the extended mind view. Now, they couldn't be too far all over the place, because what Clark and Chalmers maintain is that things that for something to count, for some tool to count as a genuine extension of your mind, it needs to be close enough that you can have constant access with it. So they think that there needs to be some kind of proximity, at least in a causal sense, to the information that's stored. So just like you can easily reach into different parts of your mind to find information that's stored in your brain rather, you should be able to access the things in the world just as readily. So if it's something you've written down, like a journal, let's say, that's stored at your parents' place, which is halfway across the world, then that wouldn't meet those conditions that Clark and Chalmers set out. So they try to set it out in a way that maybe would lend itself to having more integrity or oneness, as you say. I'll stop there because I'll probably ramble, but it's a big question, and it's part of what makes the view difficult to maintain, because you worry that it's going to leave the boundaries between the mind and the world a little too messy.
And then Dr. Vold, I'll leave the conch shell in your hands for a minute here as I ask another question directed to you. So Going back to extended mind theory, are there experimental data that include bodily processes, reported feelings of emotions, along with direct measures of skin temperature, heart rate, blood pressure, et cetera, and the correlation of these neurological manifestations? It's sort of for me too, as reported by fMRI studies related to spiritual experiences. So I'll start and then you can go, or vice versa. Either one is going to be. My understanding is that when you look at people with their iPhones, that there actually is a response in the attachment region, the so-called attachment circuitry of the brain, such that would indicate that these individuals interacting with their beloved devices are in fact having elevated responses in areas of the brain that we're seeing involved in what are classified as spiritual experiences or attachment responses.
Yeah, I think that's right. I've seen similar studies. There's also lots of studies, of course, that show how often people look at their phone. So like most people who use a smartphone will look at their phone within the first 15 minutes of waking up, and often before even brushing their teeth. And it's usually always within an arm's reach. You know, there's studies that show like how often you actually go away from your phone, and the anxiety that people feel when their batteries are low is apparently extremely high anxiety, like almost like they're going to lose their arm or something like that. So there's some studies on things like that. And then there's also some studies that show levels of distraction, which are interesting. So when the phone is present, people want to be able to use the phone to do certain tasks. They're interested in, sort of, they're attracted to the phone, I guess. Maybe I'm picking up on Sheena's language here, but the phone takes attention from them, and that could be interpreted in different ways. Yeah.
We've got a question from Hope, and Dr. Baratano, I'm going to draw you into this question as well. Hope asks, what are your thoughts on disentangling concreteness in spiritual experiences, but I'll broaden this to say aesthetic experiences as well. Hope says, I see a connection with the nucleus accumbens being a common region for aesthetic experience and religious experience. Maybe controlling for concrete and abstract experience would be interesting. Definitely, I think that would be very interesting. There is one of the hypotheses that's out there about the prefrontal cortex of the brain in particular is that you have a gradient such that as you move from the midline toward the front of the prefrontal cortex, that there's a preference for concrete representation to abstract representation as you move further forward. And so you could speculate that perhaps you would see a common core, at least from the point of view of spiritual responses. I'll let you to chime in, Sheena, about the point of view from aesthetic responses. So perhaps you would see that there's a common core of brain circuits that support these experiences that people tend to narrate as mystical in nature. And that if the content is more concrete, that the corresponding prefrontal association would be more midline, whereas if it's more abstract, it would move closer to the front of the brain. I will say that, again, with all of the caveats about it was a limited sample, it was a very specific cultural niche, that in the LDS study that we conducted, that medial prefrontal response in the brain was associated particularly highly with images that were images of Jesus or images of families. And so some pretty concrete representations that are associated with spiritual stimuli, as opposed to something, more abstract, like a doctrinal mystery or supersensual radiance of divine darkness. I'll just throw that in there. That's for you, Hope. So we could speculate that there would be this concrete to abstract gradient, but we would need to run the tests.
In terms of aesthetics, I'm going to pull that into a little bit of Isaiah's language of conscious and unconscious attraction and affinity. So what you were kind of saying about the prefrontal cortex, we see that that's even higher activation when you're looking at attractiveness, but when you're making that decision about attractiveness for something that's a little bit more concrete. Do I believe this is attractive? Do I not believe it's attractive? And again, that's more on the dorsal side. And when you go medial, it's more of a kind of implicit reaction to the attractiveness of what you're looking at. But then when you see in like that one study that was looking at when you have a subject looking at identity and not attractiveness of the subject matter, you still see these changes in the brain, but they're no longer as prevalent in those same areas that you would see concrete abstraction. And so I think there is a difference, and I think there's some relation. Pulling that to the nucleus accumbens, we don't see, you see some activation in there regardless of whether or not you're thinking about attraction, but even stronger when you're thinking about attraction than something else like identification. So I think there's a consciousness that involves the conscious decision, both causes activation of the prefrontal cortex, but also higher activation in the nucleus accumbens.
Thank you. We have a question from Miriam. Miriam says, as a primary care doc, we are starting to think about social isolation as a modifiable risk factor for behavioral and physiological illness. And spiritual community is an important part of our risk screening, which can be separated from personal spiritual experience. Any thoughts about communal context of therapeutic use of spiritual experience? Yes, many thoughts. I would love it if we had an entire sangha of Buddhists who were meditating with EEG caps or with, near-infrared spectroscopy caps, and we were controlling to look at how a group-based sangha practice as opposed to an individual practice has a different neural signature. I anticipate that it would have a different neural signature. Why do I anticipate that? For a number of reasons. One, because I experience it differently. That's extremely anecdotal. I would say that there's also some good work that is demonstrating that social isolation as opposed to social enriched experience has very strong homologies to neurocorrelates of meaning and purpose. If you can Google Scholar me and then put loneliness, meaning and purpose to like plug myself a little bit here, and you'll find an article that demonstrates that the brain, at least in ways that we measured, has similar responses to these individual self-reports of high meaning and purpose in life, and then also reports of individuals to having socially enriched connections. A lot that we could extrapolate and analyze there as well from, you know, these questions of what is it essentially that humans identify and experience as meaningful. But to answer your question, yes, I do anticipate that there would be differences between private versus communal practices. And, you know, if the Global Neurospirituality Initiative has its way, we will disentangle those differences. All right, there was a question that was also asked about general intelligence. You know, we are talking throughout the symposium about some pretty specific processes and fractionating the totality of the human into these different components. Given that the title of this symposium is Soul and Brain, I want to put out a general inquiry to the panelists about ways in which you might see some of these processes, whether it's, you know, mind and memory, whether it's consciousness, whether it's beauty, whether it's this more, you know, for now, a nebulous domain of spirituality, how they relate to some more holistic concepts from psychology and cognition, like general intelligence. Maybe to make a specific out of this general, I'll start with you, Dr. Vold. You know, you had mentioned earlier some of the ancients who were panicking about whether or not having externalized devices, even in their primordial forms, would make us less generally intelligent. I'm wondering, either from a personal philosophical point of view or from an evidence-based point of view, if you could speak to that dynamic relationship between general intelligence and some of these externalizations.
Yeah, so I wonder, Michael, what you mean or what the audience member means by general intelligence. So I've been working in more philosophy of AI lately, and the way that term is used, so when we think about trying to build what's called artificial general intelligence versus what's called artificial narrow intelligence, the way I think of that term, so it's a kind of rough and ready definition here, is sort of a narrow intelligence is being able to complete, to use some set of cognitive resources to complete some specific, well-defined, narrow task. So let's say the way that Deep Blue can play chess, or the way that AlphaGo can play Go. But they can't use that same set of cognitive resources that they have to apply to different kinds of tasks. Whereas humans, generally, we have just a core set of cognitive capacities that we, for the most part, carry around right here. But we can use that to solve all sorts of different tasks, a really wide range of things we can do. Not just play Go, but do all sorts of things. So that's the kind of the definition that I have in mind. And I'm curious if that's what other panelists think by that term. So in other words, with the goal of building an artificial general intelligence is that you want to build a system that has a core set of cognitive resources, but can use that to play Go, play chess, drive a car, you know, write a paper, write poetry, do all sorts of different wide-ranging tasks. That's what we would count as general intelligence. So the question, I don't really know of whether or not ancient scholars were thinking about that question. So that certainly Socrates was worried, or at least the character of Socrates in Plato's dialogue, the Phaedrus, was worried that writing words down would have a negative effect on certain defined or narrow cognitive capacities or resources. So things like memory or social skills in particular. I imagine that would have downstream effects on, or on his view, that might have downstream effects on being able to complete other sorts of tasks as well, besides the obvious ones. So I think you could maybe make a guess, or that would be a view he would have, but I'm not sure that they've actually written on it. I'm just not well enough read on Socrates and Plato's dialogues.
How much?
Long-winded answer.
Oh, you're good. You're good. And Karina, how much do you see within your circles concern about the circularity for these definitions of intelligence? So we operationalize, we say, okay, here is now what general intelligence is. Oh, look, we have solved general intelligence. And there's this certain maddening circularity to it where it seems that, you know, and there's this quip that Robert Sternberg made that intelligence is whatever a scientist designing the intelligence test says that it is. I guess I look at it more holistically, and this is one of the reasons why I feel quite adamant and passionate that spirituality, as ill-defined, as frankly ill-defined as it is right now, must be incorporated into our sense of what it means to be generally intelligent. If we're leaving out of the equation of general intelligence faculties and functions that really are embedded in the human being, then I don't see how we can at all justify the assertion that we have identified what it means to be generally intelligent as a human, much less generally intelligent as some kind of a synthetic agent.
I'd love to hear other panelists' views on this, but I guess my only challenge there, or my sort of reactive challenge, I guess, whether it's something I'll commit to. So one, there's lots of different definitions, especially in AI, of intelligence, as you know. But one that's gained some popularity, I guess, or sort of an intuition you might have, is that intelligence is the capacity, cashed out in whatever way, to solve some kind of problem or to complete some kind of task. And then you can measure how complicated is that task, with what set of resources is that task completed, over what time period. So there's different dimensions to that. But when I think about spirituality, I don't know how I would define that in terms of what is the problem, what is the task, what is the outcome. So that's my kind of hesitation in including it in intelligence. Whereas I think of it as being a sort of definitely a feature, and perhaps a core feature of human life and human experience. But in terms of it sort of being some kind of intelligent feature, I'm not sure how to make sense of it, I guess, in those terms.
I agree. When I think of general intelligence, I think of specifically more like an IQ, or like a way to generally pull intelligence into one concept or idea. I don't really love that. I think when you're looking at that, you're looking at those concepts and pulling them together, and that your evaluation is just of those concepts, and that you have to keep in mind that that doesn't reflect other types of emotional intelligence or other types of thought processes that you aren't associated with that number. So I think the definition is very important. You have to be aware of the parts that make that whole. To just quickly talk about beauty, I don't think that that is related to general intelligence really at all. When I think of general intelligence, I think of more frontal parietal networks. I think of higher order processing, decision making, and attention, which I don't think is needed. I think for beauty appreciation, you have your primary sensory cortex, usually that's what we're talking about, maybe not for beauty of math, but for vision in particular, audition. And then you're linking that to your limbic system and your, your pleasure centers. And that those are very old evolutionarily and within a person. And so that doesn't really require that higher level thought process. But when I think general intelligence, I think more of somebody trying to define a way of saying you're intelligent or not, which I don't love, but that's what I think of when I think of that.
I think it's an interesting question from a neurological standpoint, especially from a perspective of looking at the neurodegenerative diseases. I don't know if I'd even take a general intelligence model. I would just talk about different functionings. And neurodegenerative diseases will often follow specific domains that are impaired. For example, Alzheimer's disease shows impairment in episodic memory and visuospatial dysfunction. Frontotemporal dementia can often show changes in socialization, social norms, executive functioning, behavior, and language. And so as an interesting test case for this, there's actually a number of cases of frontotemporal dementia that are described in the literature where there's actually, with the neurodegenerative disease, there's actually acquisition of new artistic skills and other abilities. So even though from a perspective of doing cognitive testing, they've shown a decline in language, there's actually the hypothesis that Ravel had frontotemporal dementia, and actually the hyperperseverative musicality of Bolero is likely related to some of that degeneration, perseveration is an element of frontotemporal dementia. There are cases of people gaining new artistic abilities with that. And hyperreligiosity is also something. I've had several patients who had frontotemporal dementia who had the onset of new religious beliefs that they never had. They would suddenly have increased church attendance and proselytization. And that sometimes is an element of some of the circuits that are either increased or decreased. I know that you probably, Michael, in your work talked about the Geschwin syndrome, where there's perhaps a disconnection to some extent from the frontal lobe to the temporal lobes. And you can see a new hyperreligiosity. That's not to say that religion is a pathology. It's an element of certain neurodegenerative diseases.
All right. So as we're wrapping up here, we'll go with two more talking points, or two more types of talking points. One, I want to allow the panelists to ask any unresolved questions of one another that they might be ruminating over here. And then the second type of talking point is an open-ended question. I would like to hear from the panelists and put you on the spot yet again about whether or not you think that a neurophilosophy of soul would be able to encapsulate or represent more than contemporary neurophilosophies of mind. Has reductive materialism made us too drunk on reducing the number of dimensions that constitute the human experience? Is there a place, is there a need for some kind of anti-reductive neurophilosophy of soul as a counterpoint to the points being made by neurophilosophy of mind?
Maybe I'll talk briefly. We've had a number of conversations about this. I'm happy to pursue empiricism, not because I think it's the whole answer, just because I think it has validity and it's justifiable. It has validity in reference to the form of experiences we call the physical world. But I don't think that it's complete or whole. I think theories that will more fully encompass and explain human experience and phenomenal experience and consciousness are going to have to go beyond the science. There's always going to be an explanatory gap. If we identified every single neuron that was involved in a phenomenal experience, I don't think we would have answered the question. So there's definitely a lot more there.
I think I agree with Isaiah.
Agreed. I think the reductionist view is so easy because it's tangible and we have examples that show up on a regular basis if you're in the hospital. But I don't think it can come close to really explaining what consciousness is or what a full phenomenological experience is. You've given plenty of examples in neurodegenerative diseases or that patient with Broca's. They're still intelligent, they're still thinking, they just can't, always express themselves from a language perspective. And so reductionist isn't the answer, but it's easy and prevalent, and it is useful.
Well, I'm going to take from your comments that there is a utility function for a Soul and Brain 3 in 2021. So I'm very relieved. Thank you. For those who are attending and who would like to stay tuned to this type of conversation, I'll note again that in December, we're planning on having a webinar for Neurospirituality. Neurospirituality.com will have more information about that December event. And then if you really want to be on top of the game, go ahead and mark your calendar prospectively for November 2nd, 2021 for Soul and Brain 3. Thank you so much to the panelists. Thank you so much to the attendees. This has been a delight and a pleasure, and I look forward to keeping these conversations going.
Thanks. It was so nice to hear everyone else's talks, and thanks for all the great questions. And of course, thanks to Michael.
Yeah. Thank you for organizing this and putting it all together.
Thank you so much, Michael, for including